Hello everyone, I am Asia Nuevo, your student nurse from Davao Doctors College of ESN 12E. For today's video, I will perform the parenteral drug administration. Parenteral drug administration refers to any method of administration other than the oral means. However, it is the most commonly associated with injecting straight into the body by passing the skin and the mucous membranes. The most common routes for parenteral drug administration includes the intradermal, subcutaneous, intramuscular, and intravenous route. So now, in performing medication administration, it is important to remember to observe and perform the 10 rights of medication administration to ensure the patient's safety and ensure that we give our clients the most appropriate care. So now I am going to begin before we actually proceed with the actual administration of the medication to the patient. First thing we want to do is to check the doctor's order and checks the medication administration record or the MAR. This is done to that we'll be able to identify what drug is to be given to the assigned patient. We have to determine the drug's name, dosage, route of administration, and the time it is to be given. Next, check the label on the medication carefully against the EMR to ensure that the correct medication is being prepared. This is to ensure that we are going to prepare the right medication. So next, follow the three checks of administering medications. First, read the label on the medication when it's taken from the medication card. Second, before withdrawing the medication. And third is after withdrawing the medication. This is to ensure that the medication we prepare is right for the patient according to the doctor's order. Next is organize the equipments. This is to conserve time and energy. The equipments include the tuberculin syringe for the intradermal administration, 5cc syringe for intramuscular administration, insulin syringe for the subcutaneous administration, aspirating needle, hypodermic tray, kidney basin with the sterile pica forceps, alcohol, and the sterile water which will serve as the medication, cotton ball soap with 70% alcohol, and also the waste receptacles. Next to that is that I'm going to proceed now with the preparation of the intradermal medication. So, since I have no any available vials, so I will use only this for all of the three medications that I will be preparing. First is perform hand hygiene and observe appropriate infection prevention procedures. This is to observe appropriate infection prevention procedure. Prepares the medication vial for drug withdrawal. This is to be able to conserve time and energy in preparing the vial. Mixes the solution if necessary by rotating the vial between the palms of the hands, not by shaking, so that the active ingredients are evenly distributed throughout of it. So if the medication still needs to be reconstituted, then the vial would contain the powdered form of the medication and the diluent must be added into that vial. After adding a diluent, we must mix it thoroughly by rubbing the vial between the palms of both our hands. And also, I am now going to prepare the syringe, which is the insulin syringe. Next is remove the protective cap or clean the rubber cap of the previously opened vial with an antiseptic wipe by rubbing in a circular motion. So this is to ensure the sterility of the vial throughout cleaning up using cotton balls that are soaked from 70% alcohol. Then to start. So okay, I am now done cleaning with the rubber cap of the vial. Next is withdrawing the medication. Attach a filter needle as agency practice dictates to draw up premixed liquid medications from multi-dose vials. This is to practice in ensuring that the filter needle is firmly attached to the vial. Ensures that the needle is firmly attached to the syringe. When injecting into the vein, the bevel needs to be pointing up and the scale needs to be visible to see how much drug has been injected. Next is remove the cap from the needle. Then draw up into the syringe the amount of air equal into the volume of the medication to be withdrawn. This is to ensure that the amount that is needed to be administered must be followed, and when the air is equal to the volume that needed to be withdrawn, then the liquid will be also equal to the amount of the air. Then I am going to get my syringe, which is here in my hands now, and I'm going to draw an air into the syringe. The amount of air will be equal to the amount of medication that needed to be administered. Carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Avoid letting the needle touch the unsterile surface, such as the outer edges of the ampule or vial, surface of the needle cup, or the counter. Then I am going to insert the needle into the vial while maintaining the sterility of it. Inject the air into the vial while keeping the bevel of the needle above the surface of the medication. This keeps vacuum from forming. If you put into a little air, you will find it hard to draw out the medicine. If you put it too much, the medicine may be forced out the syringe. So pushing the air into the vial will prevent vacuum from forming. And if you put little air, then you will much find hard to draw it. And if you put it also too much, it might be also hard to force it out. Withdraw the prescribed amount of the medication using either of the following methods. First is hold the vial down with the base lower than the top. Move the needle tip it so that it is below the fluid level and withdraw the medication. Turn the vial upside down and hold it up in the air. Keep the needle tip and the medicine pull back the plunger to the line of your syringe for your dose. Next, introverts the vial. Ensure the needle tip is below the fluid level and gradually withdraw the medication. The air will allow the medicine to be withdrawn more easily. Keeping the needle in the vial, turn the vial upside down. After doing that, if you see an air bubble inside the syringe, then we can lightly tap the barrel to expel the air bubbles, and then I'm going to remove this aspirating needle and then throw it into the raised receptacles. And then connect the barrel now to the appropriate size needle, and I'm going to place the syringe into the hypodermic tray, and I'm going to write the medication ticket so that we won't forget what medication it is, the dosage, and for who is assigned. Next is that I am going to proceed now with the preparation of the intramuscular medication. First, prepare the medication ampule for drug withdrawal. So since I have no any available ampule because the pharmacists are not allowing to buy me, so if this is an ampule, flex the upper stem of the ampule several times with the fingernail, like this. This bring all the medication down to maintain the portion of the ampule. So I've got a lot of pharmacies and they didn't allow me to buy an ampule, so that we will just improvise. Next is use an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb and the ampule neck or around the ampule neck, and break it off the top by bending it toward you to ensure that the ampule is broken away from yourself and away from others. The sterile gauze protects the fingers from the broken glass, and the glass fragments will spray away from the nurses, bending it towards you to ensure the ampule is broken away from yourself and away from you. So if this is an ampule and you have gauze pad, and then put the gauze pad or sterile gauze pad into the neck of the ampule and then broke it away from you like this. Then place a antiseptic wet packet over the top of the ampule before breaking off the top. This method ensures that all gas fragments fall into the packet and reduce the risk of cuts. Next is dispose the top of the ampule in the sharps container. This is the proper disposal prevents possible injuries. So for the next is withdrawing the medication. First is place the ampule on the flat surface. This is to avoid the ampule from spilling. Attach the filter needle straws to syringe, and filter needle straw prevents glass particles from being withdrawn in the medication. Remove the cap of the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with the needle tip or shaft. This will keep the needle sterile. With a single dose ampule, holds the ampule slightly on its side if necessary to obtain more than ordered amount of medication. This is to follow the doctor's order in administering the medication. Then, dispose the filter needle by placing it in a sharp container. Proper disposal prevents the possible injury. If giving an injection, replace the filter needle with a regular needle. Tighten the cup at the hub of the needle and push solution into the needle to prescribed amount. This is to have the proper size of the injection and maintain sterility. Now I'm going to replace the filter needle to the regular needle. And I'm going to write the medication ticket so that we won't forget what the medication it is and dosage and for who is assigned of it. So next is that I am going to proceed now with the preparation of the subcutaneous medication. First, prepare the exact amount of fluid according to the doctor's order. I'm going to write the medication ticket so that we won't forget what the medication it is and the dosage for who is assigned later. So I'm going to prepare for the subcutaneous. And write the medication. So first is the intradermal administration. Explain to the client that the medication will produce a small wheal, sometimes called a bleb. A wheal is a small raised area, like a blister. The client will feel a slight basta
Shit. Limot ko.
Gib, tama na. Bawal daan.
Gaga. Okay.
So the first that we need to administer is the intradermal administration. First is explain to the client that the medication will produce a small wheal, sometimes called a bleb. A wheal is a small raised area like a blister. The client will feel a slight pricks as the needle enters the skin, so that the client will know what will be the nurse doing to them and for what is the medication. So hello ma'am, I am Keisha Nuevo, your student nurse for the day. May I know your birthday ma'am?
May 19, 2001.
What's your name?
Hannah.
Okay. So by the way, ma'am, the procedure that I am doing today is that I am going to administer the medication through the intradermal. This is for us to know if you have any allergies, or this is what we call the skin test. So this may hurt a little bit like a mosquito bite or a bleb, just like a mosquito bite. So is it okay to you, ma'am? Okay. Provides the client privacy so that no one from outside can disturb us while doing the procedure. So I have already closed the door and the curtain so no one from outside can disturb while I'm doing the procedure to the patient. Select and cleanse the site. First is select a site. Example, forearm about the hands width above the wrist, and 3 or 4 fingers widths before the antecubital space. This is to select the proper site where you can administer the medication. And remember, avoid using sites that are tender, inflamed, or swollen and that have lesions. This is to avoid making it in a bad situation of the lesions that he or she have. Next is apply gloves as indicated by agency policy. Cleanse the skin and at the site using a firm circular motion starting at the center and widening the circle outward to allow the area to dry thoroughly. This is to maintain the cleanliness and sterility while doing the procedure and prevent cross-contamination of microorganisms. So, prepares the syringe for the injection. First, removes the needle cap while waiting for the antiseptic to dry. This is to ready the syringe for injection while waiting for the alcohol to dry. Then, expel the air bubbles from the syringe. Small bubbles that adhere to the plunger are no for consequence. Air bubbles in the syringe need to be expelled immediately to avoid bias and result. Grasp the syringe on your dominant hand, close to the hub, holding it between the thumb and forefinger. Hold the needle almost parallel to the skin surface with that bevel of the needle up. This is the proper position before administering the medication. So the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. So next, injects the fluid with a non-dominant hand. Pull the skin at the site until it is taut. For example, if using the parenteral forearm, grasp the client's dorsal forearm and gently pull it to tighten the ventral skin. Taut skin provides easy entrance for the needle. This is also for easy handling the syringe. Then, insert the tip of the needle far enough to the place bevel through the epidermis into the dermis. Keeping the bevel side up allows for a smooth piercing of the skin and induction of the medication. Next is to stabilize the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheel on the skin. This verifies that the medication entered the dermis. So next is withdraw the needle quickly at the same time angle at which it was inserted. Activate the needle's safety device. Apply a bandage if indicated. This is to cover up the area where you injected the medication and wipe out the small blood that is being out. And remember, do not massage the area where you injected it. Massage can disappear the medication into the tissue or out through the needle insertion site. Remove and discard gloves and also the syringe that is being used. This is to avoid from being contaminated of any microorganism. Performs hand hygiene. This is to protect yourself from contamination. Circles the injection site with ink to observe the redness or the induration or the hardening per agency policy. This is to have the sign that in that site is where the medication is being injected. So next is document all the relevant information, record the testing material given, the time, dosage, route, site, and the nursing assessment. Proper documentation helps ensure the patient safety. Document the time, date, location, and the type of medication injected. Evaluates the condition of the site 30 minutes depending on the test. Measures the area of the redness and induration in millimeters at the largest diameter and document the findings. The patient will need to be evaluated for therapeutic and adverse effects of the medication or the solution. And then, document if the client had a positive or a negative skin test result. Follow agency protocol on labeling of allergies. This is to document what are the reaction of his or her skin after we administer the medication. So next is for the intradermal medication, provides for client privacy so that no one from outside will be disturbed while doing the procedure. So as you can see, I already closed the door, the curtain, so that no one from outside can disturb while I am doing the procedure to the client. Prepares the client. This is to make the patient comfortable before administering the medication. So ma'am, are you comfortable right now? Okay ma'am, thank you. Prior to performing the procedure, introduce self and verify the client's identity using the agency protocol. This is to know the patient who is the assigned nurse to them and to verify and double check if you are in the right patient. So hello ma'am, I am patient ever student nurse on the Doctor's College. May I know your birthday, your name and birthday ma'am?
Annalyn, May 19, 2001.
Okay, thank you. So, intramuscular injection. So, this medication will directly go to your bloodstream. So, I'm doing the procedure. I just want you to don't move so that you won't get hurt, okay? Assist the client at the supine, lateral, prone, or sitting position depending on the chosen site. If the target muscle is in the gluteus medius or retrogluteal side, have the client in the supine position flex the knees. In the lateral position, flex the upper leg, and in the prone position, toe in. This is to make the patient comfortable before doing the procedure, and also this is the proper positioning during the procedure. So next is obtain assistance in holding an cooperative client. This is to help us in administering the medication because you need to be cooperative, especially in terms of do not moving while the procedure is ongoing. Explain the purpose of the medication and how it will help, using the language that the client can understand. Include relevant information about effects of the medication so that the patient will be able to know why we need to administer that to him or her. So, ma'am, the procedure it is allow you for the rapid absorption of your body. Okay? Okay. Next is selects, locates, and cleans the site. This is to select the proper site where you can administer the medication. Select the site of skin lesions, free from skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. This is to continue the absorption of the medication and may cause increase the likelihood of injury and discomfort at the injection site. Next is if the injection is to be frequent at alternate site, avoid using the same site twice in a row. This is to reduce the discomfort of the intramuscular injections. Locate the exact site for the injection. This is to make sure that when you administer the medication, it is in the proper site. And then apply clean gloves. This is to maintain the cleanliness and sterility while doing the procedure and prevent cross-contamination of the microorganisms. Clean the site with the antiseptic swab using a circular motion that start at the center and move outward about 5 cm or 2 inch. Cleansing the injection site prevents it for the injection. This method removes the pathogen away from the injection site. Alcohol gives full play to disinfect after. Transfer and hold the swab between the third and fourth finger of your non-dominant hand in readiness for the needle withdrawal or position the swab on the client's skin above the intended site. These allow for easy access to dry gauze after injection. Prepares the syringe for injection to conserve time and energy. And then remove the needle cover and discard without contaminating the needle. Alcohol leaves play to disinfect after the dried and prepared injection for the medication. If using the pre-filled unit dose medication, take a caution to avoid dripping medication on the needle. Prior to the injection, if does occur, wipe the medication off the needle with a sterile gauze. Medication left on the needle can cause pain when it's trapped through the tissue. Injects the medication using the Z-trap technique. Uses the ulnar side of the non-dominant hand. Pull the skin approximately 2 to 5 cm or 1 inch to the side under some circumstances, such as for emaciated client, for an infant, and the muscle may be pinched. Pulling the skin or pinching the muscle makes it firmer and facilitates needle insertion. Hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger in non-dominant hand. Aspirate for 5 to Next is holding the syringe between the thumb and forefinger, as if holding a pen. Press the skin quickly and smoothly at 90-degree angle. Using a quick motion lessens the client's discomfort. Next is hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back the plunger with your dominant hand. Aspirate for 5 to 10 seconds. This is to administer the medication. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. Because the syringe is already contaminated and that time we need to prepare the another medication. And then if the blood doesn't appear, inject immediately, steadily, and slowly. Approximately 10 seconds or 10 ml while holding the syringe, steady if using the ventrogluteal side. Injectioning medication slowly promotes comfort and allows the time for tissue to expand and begin absorption of the medication. After injection, wait 10 seconds if using the parenteral side. Waiting permits medication to disperse into the muscle tissue, thus decreasing the client's discomfort. Then withdraw the needle. Withdraw the needle smoothly at the same angle of the insertion. This is to minimize tissue injury. So, applies gentle pressure at the site with a dry sponge. Use an alcohol swab may cause pain or burning sensation. It is not necessary to massage the area at the site of the injection. Massage can disperse the medication into the tissue or through the needle insertion site. If bleeding occurs, apply pressure with the dry sterile gauze pad until it stops to stop the bleeding. Activates needle safety or discard the uncapped needle attached syringe into the proper receptacle. Placing sharps in appropriate puncture-proof and leak-proof receptacles prevents accidental needle stick injuries. Then removes and discards gloves in performing hand hygiene. This step prevents the spread of microorganisms. Document all relevant information. The time of the administration, drug name, dose, route, and the client's reaction. Documentation of the medication, time, route, site, date of the administration, and the effect of the medication, any adverse effect, unexpected outcomes, and any interventions applied. Assess the effectiveness of the medication at the time in the expected to act. Assess the effect of the medication onset, peak, and duration for pain, bruising, burning, or tingling. Next is for the subcutaneous medication. Inject the medication. Grasp the syringe in your dominant hand by holding it between your thumb and fingers, with palm facing to the side or upward for 45-degree angle insertion or with the palm downward for 90-degree angle insertion. Prepare to inject. Inserting quickly can cause less pain to the patient. Subcutaneous tissue is abundant in well-nourished, well-hydrated people for patients with a little subcutaneous tissue. It is the best to insert the needle at a 45-degree angle. Using the non-dominant hand, pinch or spread the skin at the site of the insert needle using the dominant hand, and firm, steady push. The decision to create the skin fold is based on the nurse's assessment of the patient and Needle length use. Pinching is advised for the thinner patients. When the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the non-dominant hand to the end of the plunger. This is to inject the patient in a smooth way to avoid any much painful feelings in the injected site. Removes the needle cap while waiting for the antiseptic to dry. Pulls the cap straight to avoid contaminating the needle by outside edge of the cap. This is to ensure the sterility of the vial through the cleaning up the cotton balls that are soaked from 70% alcohol. Then, injects the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. Keeping the needle steady helps the needle in the place. And then, wear your gloves to avoid cross-contamination of any microorganism. Then, and aspirate. Remove the needle. Remove the needle smoothly, pulling along the line insertion while depressing the skin with your non-dominant hand. Withdrawing at the same angle prevents tissue damage and increased pain at the injection site. If bleeding occurs, apply pressure to the site with a dry sterile gauze until it stops, so that the blood will stop the blood and apply pressure but gentle only. Dispose of supplies appropriately. This reduces the risk of infection and the spread of the microorganisms. Assist the patient into a comfortable position. Flip down medication ticket if not using EMAR, so that the patient will feel comfortable after doing the procedure. Do the aftercare. Remove gloves and dispose used items in the appropriate waste receptacles. Return to the other equipment to the proper place, especially the MAR machine. This is to maintain the cleanliness of the items and reduce the risk of any microorganisms. Assess the effectiveness of the medication at the time it is expected to act. It is important to evaluate the therapeutic effect of the medication and assess for the adverse effect. Then, document all the relevant information. Many agencies prefer that medication administration record be recorded on the medication to the medication record. Timely documentation ensures patient safety.